Diathermy is a medical technique that uses high-frequency electrical currents or electromagnetic waves to generate heat within tissues. This heat can be used for various therapeutic purposes, including cutting or coagulating tissues during surgery, promoting tissue healing, and relieving pain and muscle spasms. Diathermy has been used in medicine for many years and comes in different forms, including shortwave diathermy, microwave diathermy, and ultrasound diathermy. Here, I'll provide a detailed overview of diathermy. Basic principles. Diathermy operates on the principle of converting electrical energy into heat within the body's tissues. The high-frequency electrical currents or electromagnetic waves used in diathermy pass through the body's tissues, encountering resistance from the tissue's electrical resistance. This resistance generates heat as a byproduct. Types of diathermy. Shortwave diathermy, SWD, uses high-frequency electromagnetic waves, typically 27.12 MHz, to generate heat deep within the tissues. It's commonly used for conditions such as arthritis and muscle injuries. Microwave diathermy utilizes microwave frequencies, typically 2450 MHz, to produce heat in tissues. This type is often used for superficial heating and is less common than SWD. Ultrasound diathermy uses high-frequency sound waves to generate heat in tissues. It's often used for musculoskeletal conditions and deep tissue heating. Therapeutic applications. Surgical diathermy. In surgical settings, diathermy can be used to cut or coagulate tissues. The high heat generated by diathermy can be used to precisely cut tissue while minimizing bleeding by sealing blood vessels. Physical therapy. Diathermy is commonly used in physical therapy to promote tissue healing, reduce pain, and relax muscle spasms. It can help with conditions like muscle strains, joint stiffness, and arthritis. Wound healing. Diathermy can stimulate blood flow and promote tissue regeneration, which can aid in the healing of chronic wounds and ulcers. Safety and precautions. Diathermy should be used with caution around implanted electronic devices like pacemakers, as it can interfere with their function. Care must be taken to avoid burns or overheating of the skin during diathermy treatments. Proper patient positioning and grounding are essential to ensure the safe and effective delivery of diathermy. Contraindications. Diathermy is contraindicated in some cases, such as in patients with metal implants, open wounds, or cancerous tissues. It's important to assess each patient's suitability for diathermy treatment carefully. Equipment. Diathermy machines consist of a generator that produces the electrical current or electromagnetic waves and applicators or electrodes that are placed on or near the body part being treated. Professional training. Diathermy should only be administered by trained healthcare professionals who understand its principles, applications, and safety precautions. In summary, diathermy is a medical technique that uses high-frequency electrical currents or electromagnetic waves to generate heat within tissues for various therapeutic purposes. It has applications in surgery, physical therapy, and wound healing, but it must be used with caution and under professional supervision to ensure safety and effectiveness.